quickly add water. And if you believe that, you can go into detail. So Peter, tell us a little bit. We have very little time, but we do want to know what motivated you to want to study medicine. Was it your mother who said, Peter, you've got to grow up and get a job, you have to stop playing around and get serious? What was it? How did it all happen that you became Dr. Peter Shaw?
The short story is that my father was a doctor and everybody in my family tree was a doctor, and I didn't really have much choice. The long story would take forever, so let's move on to the next question.
Well behaved. So tell us a little bit about your training before you went to, you were good at sciences, I guess, because otherwise you couldn't have gotten into it. You were good at taking tests.
Yeah, I probably should point to set a bit of background here. Although I have a strange accent, I'm from Scotch Plains, New Jersey, as you can tell. I've spent a lifetime studying the way doctors interact with the pharmaceutical industry and the way that they interact with their patients. And there's one thing I'm good at, it's observing that interaction and those interactions. It's always a pleasure to be invited along to these sort of events. But is there anyone else who's an MD or a doctor by training in the room?
Just take a little sip of this.
This is what I find fascinating about these. This is all about the pharmaceutical doctor interface, and yet we're often the last person that you ever come to and talk to about how we are and how we work. And for 25 years, I've sat the other side of the desk from people who are representing your companies, and am amazed at how little understanding they have about me and about how I was trained and about how I work and how I assimilate information and how I interact with my patients and how I make a prescribing decision when it comes to the end of those interactions.
So, Peter, I mean, it sounds horrible. Give us an example of
the examples start with the person who walks in and asks me how I do something when they know they haven't got much time. You know, I can talk for 3 months on the treatment of hypertension without taking breath. And the problem as I see it arises is that doctors are problem orientated. Most of the people who come and see me in my office are product orientated. And there is the disconnect that starts from the second that they walk in through the door, is they are thinking product and I'm thinking problem. And unless we can connect on the same wave level that I'm on, then we're never going to make that connection, which is going to get them to where they want to get to. What I need is solutions to problems. All I do every day of my working life is solve problems.
That's great.
All I need
is
solutions to problems.
My Lipitor scripts are,
But you have a solution to a problem that I have. It just needs to be much more specific. Let's take an example. How do I treat diabetes is one of those open questions which, for a 90-second interaction, is impossible. But do I have problems getting the HbA1c down of a gentleman of Asian extraction who's got central obesity, he's got hypertension, he's got diabetes, and he's now on a Western diet? Yes, I do. Well, I've got a solution to that problem, which is our product. And there is a way about going about it which will engage me in a place where I am. If you think about any sales process that your companies has, is you go through the pre-call planning to the introduction of the product, to identifying the problems, to going through, to qualifying what you say, to come to some sort of conclusion and close, and then moving on. Well, remember that that's what doctors do with every single patient that they see. What does a doctor do before they walk into the exam room? They take the chart off the wall and do their pre-call plan. What do they then do? They find out why they've come to see me. I then take a history. I then start to think about what investigations I'm going to do, what lab tests, examine the patient, maybe come to a tentative diagnosis, see them when I've got the results of those tests, at which point I'm getting to the point where I might be thinking diagnosis and treatment. And where does product come into that thought process? Usually at the end. It's not at the beginning. Now, what's different is that is different with every patient that I see. You know, the little snotty child coming in with a discharge in ear, a fever, and a headache, and things. Well, you're starting to think, well, probably otitis media.
Okay.
So you to the different point.
So I got to stop you right there because